Hi, I've been asked to do a brief introduction for IPT, which stands for Insulin Potentiation Therapy. Now, briefly and in lay term, cancer cells have many more insulin receptor sites. Insulin receptor sites are like doors in a room. So, cancer cells have 1,000 to 10,000 doors, whereas normal body cells have one door to the room. So when you give a small dose of insulin in a well-controlled environment, you open up the doors and then you can give a smaller amount of chemotherapy, of course based on chemosensitivity if possible, and then you follow that with a sugar, which will help literally push them through the door. Now we know that CT PET scans are based on the fact that cancer cells love sugar. So what is a CT PET scan? A CAT scan measures bulk. Let's say we're talking about cancer. The tumor is 8 by 9 centimeters. However, a CT PET scan goes a further step. We inject 18-fluorodeoxyglucose. The 18-fluoro part of the molecule is what fluoresces, and the radiologist can see it. It measures metabolic activity. Cancer is very metabolic, hypermetabolic. So the glucose part, 18-fluorodeoxyglucose, is what gets the molecule into the cancer cell. So that's more case in point that cancer loves sugar. And we use this in mainstream medicine. We give the dye to give us the CT PET scan, measuring size and metabolic activity. Because sometimes you have scar tissue, you're not sure if it's cancer or not. If it doesn't fluoresce or light up, as we say, it's not cancer, it's scar tissue. So we just kind of showed you why insulin potentiation makes a lot of sense. Again, recapping, cancer cells have 1,000 to 10,000 times the amount of insulin receptor sites, doors into the cell. They love sugar. So what we simply do is we give a small dose of insulin. The patient sugar drops down. We monitor their sugar. And then we give the selected chemo, and then we have them eat a natural sugary food, bananas, pineapples, fruits, and that helps again push the chemo specifically and targeted into the cancer cell. So we don't have to use quite as much chemo, the patient does not get sick, and we're targeting the cancer cells and killing them more selectively. So it is a kinder and more gentler type of chemo. And we have been getting phenomenal results. While we give the chemo, we also give several things to enhance the chemo to work more efficiently, such as specific things that vasodilate the arteries in the tumor. So again, getting this chemo specifically into the cancer cells. We also give natural things that keep the chemo in the cancer cells longer. And then we give things to buffer the side effects at the same time as we give the chemo. We also utilize many other things, not just IPT, and IPT is not for everyone, and not everyone should use it if there's other possible things that are better. You should not be fixated on one mode of treatment. Immune enhancement is also important, and we use many things to do that, and we do specific blood testing to see where your immune system is. Natural killer cells, Th1, Th2, killer cell functionality, and it goes on and on. And the things that we use to boost the immune system are endless, including hyperthermia, mushroom extracts, epicor, and the high-dose vitamin C, glutathione, lipoic acid, GCMOF, on and on. We utilize many schools of discipline, including bioelectrical medicine, acupuncture, nutrition, and other nutraceuticals. We will make other further videos on other treatments for cancer, but the take-home is you have to attack cancer at every angle in order to be successful.